chapter 1. I hope y'all ready to teach me. What is chapter 1 about overall? First of all.
The first chapter.
Yeah, it's the first chapter about what?
Mom and child.
No, that's the whole book.
How it's
Mortality, morbidity.
In the beginning, it was
Morbidity,
like,
mortality.
And how was pregnancy looked at back in the days?
Terrible.
Scary.
It's very scary. I think it was Lexi that mumbled the word, what? Death? Pregnancy was almost equated to death. If you were pregnant, it was as if either you or the baby, somebody gonna die. Somebody's not gonna make it. Why was that so?
People were scared or didn't have the confidence to.
Okay, one at a time. Vanessa and then Anna.
People didn't have insurance or the financial stability to seek prenatal care, and they're also scared to seek prenatal care.
Okay.
There was like certain like diseases and illnesses back in the days, and like lack of immunization.
Lack of immunizations, certain diseases way back in the days, like colonial times, okay?
Malnutrition as well.
Malnutrition was another one, okay? That's another reason. So that's another reason, that's many of the reasons why pregnancy was looked at like, listen, it was almost as if it was a curse, so to speak, right? All right, so then, please work, yeah, it worked. Now, my question to you, okay? Now, as time evolved, what did we start seeing happening?
evidence-based practice started developing.
Okay, but before that, yes, what do you start seeing?
Doctors, hospitals.
Yes, okay, so it was interesting to know that it wasn't until the 1950s you see natural childbirth starting to take place. 1950, that's like yesterday. In my other countries, that was like done way before that. I was surprised to learn that, okay? And then you see that there is a return. Midwives and doulas is now starting to come back into place. Midwives and doulas in certain countries, that's what all you had, right? In certain countries to help induce labor and delivery. Anna was saying one of the main things that you did see a lot of is infection. Infection was prominent, and that's why the poor care as it relates to infection led to stillbirth or death of the mom. Okay, that's what you would notice to see. All right, boom. Then all of a sudden you see this man come around who's known as the father of pediatrics. Okay, Abraham Jacobi. Then you start to see that their maternal newborn starts to become more evolved, okay? And then in the 60s, you start having nurse practitioner. Now, what is important for you to know is that, for testing purposes, is that you will notice that nurses start to advocate for OB patients or maternal patients and children. Why? Why is that important? Why was nurses advocating for these patients? Or why was it important that nurses were advocating for these particular population? Let me ask it that way.
Because they can't advocate for themselves?
Huh?
Because they can't advocate for themselves, the children at least.
Okay, what else?
And then...
What's another reason? You're right. They couldn't advocate for themselves. What's another reason? Nurses played an important role in advocating for this particular population.
For pregnant women and...
Pregnant women and children.
Would it be because medicine was ran by men and women really didn't have a voice?
Ooh, I didn't even think about that, but that's actually a thought. Medicine was ran by men and women didn't even have a voice. Is that even something that's important? Medicine was ran by men and women didn't even have a voice. How is medicine being run by men and women not having a voice? How did that impact the whole caring process of that population?
Because you're looking at the patient like a statistic rather than a person.
That's one.
They would treat women in the same way that they would treat men and not take into the account that women's hormones and everything is different than men.
So nurses, and remember from fundamentals, nursing was a profession that was predominantly ran by whom? By whom? By women, okay? And nursing in general, or historically speaking, if you remember back in fundamentals, that was is known as what? To nourish, to nurture. So you didn't see that a lot, especially for the pregnant women and children. They didn't have a voice, like you said. So we needed nursing to come up and evolve so that you could see that they were better taken care of. Then you start seeing more and more often birth was taking place in a hospital setting, and there was actually much better history. Now, what I do want to get into is, all right, Healthy People 2030. Of course, you already know about Healthy People 2030. It will come up as a test question, hint, hint. All right, what was their purpose? Again, for promoting health and disease, but their goal specifically was equity, literacy, and healthy, thriving lives. Okay, make sure you remember that for testing purposes, because you got to know about Healthy People 2030. Now, another thing you mentioned is fetal mortality. There was a lot of fetal mortality and, of course, maternal mortality. Now, I know you mentioned infection being a reason. Besides infection being a reason for fetal mortality rate being so prominent back in that day.
So for mom, is poor nutrition, disease, the cervix opening too soon, and for the baby, is genetic issues and placenta problems.
Say it one more time. You said it. You said exactly what I need. I need it to be louder.
So for the mom, it's poor nutrition, disease, cervix opening too soon, and
Cervix opening too soon. Okay? Yes, continue.
and then for the baby, it's genetic issues and placenta problems.
And that's why you see the mortality rate or these infants not living as long as they could have, okay? For those specific reasons. So I want to make sure you are aware of that because it's going to come up in your test.
I have a question.
Yes.
For the, what we just said, is that like now or that was in the past?
In the past.
Okay.
It was in the past. They're doing much better. That was in the past, correct?
Yeah, because
And-
now it's the accidents are the
Yes.
Okay.
So that was in the past. All right. Now, of course, what you're seeing more, especially with the, and you'll notice. Sorry if hopefully I don't confuse you. We're going to be going in and out between maternal and OB for chapter 1. So you'll see we're going in and out of that. But as that relates to now the pediatric population, what you're seeing nowadays in terms of death, what's causing the death, 1 to 4 unintentional injuries, and then of course congenital malformations, and then from ages 5 to 14, again unintentional injuries. But notice their mortality rate is usually caused by cancer and suicide, homicide, and diseases of heart, influenza, and pneumonia. It was interesting to see that. I could understand the homicide, but the suicide, I want to talk about that.
Social media.
Okay, why would the suicide rate be so high, okay, or even prominent in this particular age group?
Back then or now?
No, this is happening now.
Yeah, that's social media.
Social media. Any parents in the house, or am I the only parent? Oh, I thought I was the only parent. Okay. How old again?
2.
So you ain't got that much to worry about yet, in terms of
She's locked in the basement now. So.
no. Sabrina,
22 and 14.
22 and 14. Where's my other parent? Atrice?
18 and 14.
18 and 14. So you're right up in here. Danny?
9.
9? I thought you was gonna say 9
You got
and I was
more.
gonna say Treasure?
3 and 2.
3 and 2. I'm just curious, okay? For those of you who have children and around this age group, or that was on that age group, was this your concern? Would this have been your concern, suicide?
It is.
Yes.
Yeah, okay, I ain't gonna lie to you. I mean, I have children. My youngest is 13, oldest is 18. Take it easy. Okay? The other cause of morbidity, as you see, is cardiac disease. That's what I want to get to. Primary leading onset of death, cause of death in female. And then, of course, the second leading cause of death is cancer. You gotta know this. The primary leading cause of death for females is heart disease. And this is according to the American Heart Association. What's also the second leading cause for females' death is cancer. Make sure y'all remember that. Now, for children, what's the leading cause of health issue, health concern?
Obesity.
Damn, obesity. I wonder why.
Put them outside.
Food we're eating.
Huh?
Type of food we're eating.
The food we eating and
Put them outside.
they're not being outside enough. Or the sedentary lifestyle. Nowadays, what's the activities nowadays?
Video game.
Video games. Yeah, technology. What is it? TikTok. Yeah, TikTok. Roblox. Cause the other day my daughter was like, "Oh, can I have money to buy Roblox?" I thought, "Girl, you gonna get your behind and start cleaning this dishes right now?" How about some money for Roblox, okay? No, get up and go do something. Go out and mow the lawn or something, I don't know. Okay? Obesity is one of the major health issues. Environmental toxins. Also allergies, drug abuse for children. I could see that being a nice little test question. Drug abuse. How could drug abuse be part of childhood morbidity? Huh? Speak louder.
Because kids are
Using drugs?
easily influenced and doing drugs nowadays. Like we had, what was it called? I mean, like we had the DARE program and we still broke our promises.
Oh my God, they still do DARE?
No.
Oh.
It's called LEAD now. In the school system in New Jersey where I'm from, it's called LEAD.
Weed?
LEAD. L-E.
Oh, I was gonna say, my bad, I'm bad. Hey, I don't know. Lead.
L-E-A-D.
Okay, my bad. Lead. So that's what, how about anybody else? What is it called now for DARE? Because I didn't hear DARE in a long time. Okay? But you said, Treasure, that you broke your promise? Y'all broke?
Eventually, I was over 18 though at that point, but I was just saying that like back then we had the little commercials about smoking cigarettes, but now it's not smoking cigarettes, it's vapes. That's really the big thing with our generation.
No, but seriously, I don't know what they call it now, but seriously now, even my youngest who's in junior high, she would always tell me, Mom, I saw the vape cigarettes and how there's kids her age, 13 and even younger, that are like smoking.
Yeah.
And I was shocked. I was like, I was questioning my life at first. Like, should I take her out of the school and go somewhere else? But then I thought,
It'll be everywhere.
it's going to be everywhere. So what's the point? All I got to do is do my education, be like, girl, don't you let me catch you.
It's worse in private schools because they have money.
Ooh, I would never have thought about that.
I had friends that went, so I went to public school and my friends went to private, but they have money, so the drugs that they had access to were like higher because they could afford it.
Oh, wow.
Yeah, like my peers smoked weed.
Hold on, guys.
So like my public school peers, like the drugs that they would do is most commonly like weed and alcohol. But then the friends that went to the private school were like ecstasy, like cocaine, like all those.
High school?
Yeah.
Yeah.
Ecstasy?
Yes. John Carroll.
It's more
Fort
classy.
Pierce.
I was literally just about to say John
Their kids were on
Crazy.
High school?
Yeah.
Yeah.
I mean, I get it, Miami, yeah, but no, but
Nah,
I
it's
thought the most
everywhere.
they did was weed.
No.
But ecstasy?
You're right, though.
My mom would never
A
let
kid
me go
overdosed
party
in my
with them. I
parking
used
lot
to-
in high school on
And the different groups.
On Xanax?
They do a lot of stuff.
That's scary. That is very scary. Okay?
So.
Now, of course, in addition to drug abuse, of course, now we know that they are prone to child abuse, neglect, mental health issues. Mental health issues, even amongst children, is on a rise too, which is surprising. But of course, given everything, many factors that's taken place, I think with, if I'm not mistaken, COVID even made it worse.
Yep.
Okay, for children and adults who have to deal with those children, but COVID made it even worse, and the incidence was even higher.
Yep.
Okay, now morbidity, what causes morbidity in these children is definitely homelessness. Pretty much self-explanatory. If you don't have access to, quality food and quality resources, of course, your chances of dying are going to be much higher. And they are going to be prone to low birth weight, health disorders, and disability. So that is expected. Now, factors affecting maternal-child health. How does the family setting affect the health of individuals, specifically the mom and the child? The family dynamics. How can that have a negative impact on the population?
Like the parenting style?
Okay, you elaborate. What you mean by the parenting style?
Like the way you reprimand them, like if you don't give them praise for doing certain things that are.
You're gonna have to speak louder because I don't think Adam Mary heard you, and Adam Mary is trying to get the answers to the test.
So like the way you like reprimand them affects the way the trust in the relationship.
Let's talk about that. You say the way you reprimand a child can have a negative impact on the child. You want to elaborate on that for me a little bit?
It's later in the book.
It's later in the book, but it's okay. We skip. You already opened the can of worm a little early.
So in the first view in the book, it said telling them no and affirm, like getting them isolated, telling them no is a good way to do it. Don't, and then making sure that you praise them for doing certain things that are good.
Gentle
That's-
parenting.
yeah.
Not in my household. Let me stop. Let me stop. Jeff,
Yes.
family dynamics. How can it have a negative impact on mom and the child?
Well, let's say if the
Sorry.
parents are getting divorced, for example, they lose their job, or the father beats up the mother, that can affect a lot of the time.
You said father beat. I see your hand, Sabrina. Father beats up the mom. Now, mom could also be beating up on daddy too, because that does exist. So let's take away that stereotype that domestic violence only occurs to the female, and like the female ain't also doing that. There are not females out there that's not also, boxing they man. You know what I'm saying? I'm not condoning it. I'm just saying that it exists. Okay, Sabrina.
I was gonna say with domestic violence in the home.
Oh, domestic violence in the home. Okay.
It's not just domestic violence, but like the kids are when they're younger,
Mm-hmm.
they're gonna emulate what they see in the house.
That part.
So however the mom treats the dad, however the dad treats the mom, however, wherever they go, how they interact with other people out on the street, they're gonna learn that, and that's what they're gonna start basing their rights and wrongs and all that, like all the stuff that we went over in Care 1 with the developmental stages, all that's gonna start.
Oh, look at prom academic mom right now. He mentioned care.
All that stuff kind of starts playing out where they start growing and learning from the parents, and then as they go, they'll start putting that into the world and seeing what works for them best.
Okay. Shannon, you had your hand raised?
If you have like a single parent household.
Oh, were you reading my mind? Were you reading my mind?
No, I lived it.
Oh my God, I was about to ask a question based on that, but go ahead.
So if you have a single parent, right, obviously it's harder financially. There's a lot of stress. So the parent might unintentionally put that stress on the child, or the parent is not present because they're always working to support themselves and the child. So there could be a lack of like connection or love and affection depending on who the child is being like who's caring for
the child. Yes.
Yeah.
Very good. Treasure.
And on that note, I feel like having like a single parent versus a two parent household can also like the finances basically, because some parents can afford, like we were talking about obesity, so a single mom or a single parent might not be able to afford they probably have an obese child because they can't afford having healthy food versus a two-parent household, even though it's still kind of hard with two-parent households. So like things like that.
Not only that, to piggyback on what you just said, if that single parent household, they're struggling. They like low income. I'm not saying all single parents, all right? Just saying it's something that can exist, right? In the environment in which that household the family lives, there's not much choices. Okay, what's going to be? We talked about this before in Care 1. What are usually the choices when you're in a low-income environment or neighborhood? What are the choices available?
Dollar General.
Dollar General. Why are you hating on Dollar General? I think they have healthy chips.
Because it's Dollar General, it's a dollar.
Wally World.
What's Wally World?
Walmart.
Oh, my bad. That's how y'all call it?
Okay, you're doing too much.
You do Wally World. What else is there?
Fast food restaurant.
Fast food. So Mickey D's, BK's,
Liquor stuff.
Man, I just learned last semester there's a drive-through liquor store.
Be so for real.
I am so for real. Okay?
We hitting it up on a lunch break? Hitting it up on lunch?
I didn't know. So imagine that's your choices in those neighborhoods. Now, before I forget, does that mean in a single family home that the parent does not love their child or children? There's still love, it's just the resources are not readily available, financial resource. So we're struggling for a little bit, and that struggle is going to lead to stress, correct? All righty. Don't play with me on that question. Now, genetics. Hurry up. What about genetics?
I'm raising D1s over here.
Race associated.
Wait a minute, hold up. Time out.
D1, baby.
B1?
Division I football, Division I college football, whatever, baseball, sports, whatever.
What that got to do with genetics?
Yeah. If your mom was a college athlete and your dad was a college athlete, you're probably gonna be a college athlete. But if your dad
I mean,
sat on the couch,
Listen, if your mom was running a 4.4 and your dad is running a 4.2, listen, you're probably gonna be running a 4.3.
Really?
just
Is that statistically realistic?
look at most athletes and their kids.
Yeah.
Yes, Alex.
If your mama or your daddy got an autosomal dominant disorder, there's like a 50% chance your kid will have it.
Thank you. Thank you.
Yeah, that too.
And if your parents are siblings, that's affected.
Say it again.
If your parents are siblings, that's affected.
If your parents,
Or siblings.
let me let that marinate for a minute. If your parents are siblings,
We're in the Midwest now.
no, but incest does exist, okay? But yes, what is it with? Damn, Ariana, what were you saying about incest parents?
It messes up genetics.
How so?
It messes up the chromosomes.
Okay, yes. So there's a high chance that that child may come out with a genetic deformity. I was trying not to be saying that rude, okay? Huh?
Or intellectual disability.
Or yes, okay. That is why. Society. What about?
What is it that causes that though? Like, how does that happen though?
You know, it's something with the genes. I do not know the specifics, but all I know is that it has to do with what they say, like the chromosome.
Is it the similarity though? Is it
Yeah.
too
If you
similar?
have two people who have a similar problem and you put them together, there's a very high chance that similar problem is going to come out again.
No, but he's saying that
Yeah, like for example, the mom and dad are
the mom
healthy.
and dad are brother and sisters.
And
Too much
it-
DNA. Too alike.
So that's what all I know is that.
Happen all the time. Even small mutations happen all the time. They just the body fixes them.
Well,
But
true.
even with two healthy people, if they're both having the same issues, even if it's small and they present as healthy, eventually something's going to come out that's wrong. And that's the problem that we saw with like kings
European
and queens
kings, yeah.
that kept going and kept going.
Oh, yeah.
There'd be
Oh,
these small issues. They keep
yeah.
showing up, and eventually they'd have that one prominent thing that became the thing they were known for.
The chins.
Yeah, the chins. Started off as nothing, but you keep putting it together.
Or they were
Yes,
insane.
that's true. That is true. That is a good thought. I didn't even think about that. You're right.
I'd assume that's why.
Adaptive, not a sticker.
Who's the chin?
Not a sticker.
You reminded me that I have stickers. I have something else too, but I gotta say that one later. All right, society. I mean, really, you're not even.
I answered a great question.
You did. You're not even part of the. Okay, you had a heart for being here because you care. Society. Hold on. No. Science. How does society impact the family? Hurry up.
Laws and.
Laws. What laws got to do with anything?
Sorry, not laws. I guess like socio-economic.
Okay. Elaborate before Treasure try to steal your shine.
So depending on where you live at, what that society is most concerned about is going to affect the mother and the child's health. So like if a city is more concerned about conserving green versus WIC, then you're gonna have less programs that help out mothers and children or things of that nature.
If a city is more concerned about preserving greens, is what you said?
Yeah, like
so the
trees and stuff.
trees and urban footprints and all that stuff.
What is the community most concerned about? Is it the child and
Or the-
health, or is it things like?
So that child, the mother and child will have less access to certain programs such as WIC. Okay, or have difficulty access. Okay, all right. You saved yourself. Treasure.
So, things like poverty.
Mm.
So if you live in an area that people don't make a lot of money, they might feel like they have to do certain things like rob or sell drugs to make money. And then you also have people that live in poorer communities where it's violence, and kids might grow up thinking that being in a gang is is cool. So now they're all participating in games and shooting people over blocks that they don't own.
Man, okay, you answered all my notes. You had something.
Well, I mean, I had poverty, media, violence, and community.
Okay, you said it all. Okay, all right. Global society, real quick. Well, the world, politics. What else?
Society.
Now you mentioned this a little bit. How does culture play a role?
Their beliefs, values. what they-
Elaborate.
So like if like your tradition, like what you're used to doing is different. I'm not speaking anymore.
Adamari, you heard her? You heard her? No? Okay, Adamari. You trying to hook Adamari?
Okay.
Hook Adamari up with the answer.
Okay, so I put for culture, beliefs, values, tradition, and religion.
Okay, Adamari, since you heard that, give an example of how culture plays an impact on the health of a mother and child.
I'd say like in certain religions, like when it comes to health, there's like different thought processes of like why you get sick, like it could be something spiritual, like that associated with it.
You have an example of that?
Sorry. That's the first thing that came to my mind.
Okay, say her answer.
Vaccines.
Vaccines?
And
Oh, no, I said like before there was like the autism label, like a lot of cultures thought it was like, I'm gonna speak for my culture because I don't want to offend anyone, but it's like with Haitians, they always think something is spiritual, like, oh, they did that to him because like your mother did something in her past.
Okay, it's not specifically with autism. And autism and the thought process between autism and vaccine is not a cultural thing, it's like a society thing.
Yeah.
There are some, especially moms, but there are some a lot of parents who would not give their children vaccines because they correlated it with vaccines. If they felt like if once their child had vaccine, that's when their child had this condition. But, hold on, I see your hand. With regards to, since you want to give an example of Haitians, what was your example generally?
Well,
with?
no, that was I said autism, like that was one of the things before we knew what it was. Cause you know, like kids were nonverbal or, you know, stuff like that. So it's just like anytime there's like some type of mental or behavioral issue with a child, I just feel like that label was usually put.
So with Haitians in general, if you sick, it's because you offended the spirit world.
Yeah, kind of.
Seizures is because you offended the spirit world. Like you're having a stroke. It's not because you ate that oxtail all day, you know, or Mickey D's all day. No, it's because you offended the spirit world. They still are like that. Wait, was it Grace? Grace and then Sabrina.
In terms of religion, I know that there's like Jehovah's Witness. Let's just say the child needs an urgent blood transfusion, but they don't accept blood. Like that obviously affects the child's health overall because it could be life-saving.
There was a show, I think I mentioned to you guys in first semester, I think it was Resident or one of them hospital shows, medical shows. A mom refused to give her child blood transfusion because of being Jehovah's Witness and their belief around blood transfusion. I wish I was gonna play it, but we ain't had time for that. But yes, that is still a thing. Although I am learning now that for Jehovah's Witnesses, some of them now, they will accept blood transfusion if it's like from themselves, like autologous blood transfusion. But generally speaking, for test purposes, overall, Jehovah's Witnesses don't accept blood transfusion. It's very hard. Sabrina?
I was gonna say that parent that killed their child here in Port St. Lucie.
Killed?
Yes, ma'am. They put a pillow over their child. They were trying to do an exorcism. I believe the child may have had something like autism or something. It happened here in Port St. Lucie. The lady thought she was doing an exorcism on their little one and killed them. And the school called it that the child had been missing for say 14 days or whatever the number was. And they did a home check and the baby was laying in bed dead.
Oh no. This was recent?
That is more to it than that because she had like a mental psychosis.
Which is ironic.
So,
Considering she was worried about the kid having.
No, I'm too busy trying to, figure this out. When was this?
Yeah, it was a
Oh, wow.
recent.
It was in Fort Pierce.
It's in Fort Pierce, yeah.
Oh, wow.
Okay.
But the thing is that people said that he was displaying signs appropriate to his age, and she associated that with demons. So, and she was going through like a, yeah, she was going through like cartoon psychosis pretty much.
Oh, wow. That poor child. How old was the child? 6?
7, something like that.
Oh, damn.
Yeah.
Okay. Wow, I didn't know that one. Damn, that's like very local. All right. So we talked about culture. We already know about health status and lifestyle. We already know that if you're smoking, for example, the child could be prone to what disease? Asthma, bronchitis, etc. Okay. Access to healthcare. We already talked about that a little bit, but you know, if you have inadequate access to healthcare, your outcome, your healthcare in general will be poor, right? And then, of course, there is this thing with improvement and diagnosis and treatment. You would think that with the advancement in technology that nobody would be sick that much, but no, what it is people are living longer. You find people are living longer with the disease process. All right, moving forward. Now, negatively or positively influencing factors that affects a person. Positively, you already know, as you can see, is that it will promote healthy growth and development, but definitely on the negative or the flip end of that, it does increases a person's health risk if they're not careful. This is important. The legal and ethical aspect. Fundamentals right back at you. Okay, now, you already remember all your ethical principles and legal principles, right? Yeah? George, give me one ethical principle. One ethical principle.
Justice.
Okay, what's autonomy? Easy one. What's autonomy?
Allowing the patient to kind of make choices.
Okay, remember autonomy is not limited to the patient only, okay? Okay, family, nurse, etc. Jeff, give me another ethical principle before Ariana steals your shine.
It's like beneficence, right?
Yeah.
Raise your hand.
You know, I'm just saying.
I see what he did there. You see what he did? That was very slick of you. Okay, now that you got beneficence, what is beneficence, Jeff?
Don't make the harm, don't cause harm.
It's to
Do the good thing, don't cause harm.
No, don't confuse it. What is beneficence, Danny?
Acting in their best.
Doing
In their best interest.
Beneficent. Hold on. You're very fluent in. Hold on. You're very fluent in Latin, right? You're very fluent in Latin. In the Latin language? You're very fluent in the Latin language, are you not?
Apparently not.
Beneficence, what word do you see in beneficence? Ben. Ben means what? Good, that's it, not our because you said to do no harm. Which one is to do no harm? Non-maleficence or non-malfeasance, however you want to pronounce it, as long as you get it right, okay? Do not confuse the two. Beneficence.
Acting in the best interest.
Do good. Non-maleficence.
You don't do bad.
Oh, don't do bad. Okay, if that's what you want to say. What's another one? Sabrina, Sabrina, Grace.
Veracity.
Veracity. What is that?
Truth.
The whole truth and nothing but the truth, so help you. Okay, what's another one, Sabrina?
Fidelity.
Huh?
Fidelity.
Validity.
Fidelity.
Oh, fidelity. My bad. Okay, I heard validity. What's fidelity?
Being trustworthy and honorable to your situation or person,
Keeping it
or keeping it real.
Okay. All right. Wait. Hold on. Which one did Grace say?
Veracity.
Veracity. And you said?
Fidelity.
Fidelity. Fidelity. You said is what now?
Faithfulness.
Like, say in a marriage is being honorable and true to your spouse, like not cheating on them.
I always
being
remember that because of the
faithful to them.
Okay, just keep it. Yeah. Faithful.
Don't cheat on your patient.
Yeah.
Keeping your promise. Anna.
Justice.
Oh, queso.
That's where you treat your patients like fairly and equally.
Okay. Now when it comes to the younger population or this particular population, now we have to deal with legal and ethical issues. It's going to be a little bit more complex, okay? In essence, right? We have the issue of abortion. Now, when it comes to abortion, basically what is abortion? I don't know what that is.
Ending a pregnancy.
That's all I hear.
Termination of pregnancy.
Termination of pregnancy. Now, I ain't read it in the book. Hopefully you read it in the book. When is it permitted for you to commit?
Depends on the state.
Oh, damn. Okay, you got me. But in general, like you say, huh?
Under 6 weeks.
Yeah.
But that's what the book said?
I don't think the book says because it can't.
It varies by law.
23 weeks?
That's 24 before viability.
Yeah.
When you, if you're allowed to.
It's essentially like to the point where if you were to come out, you would be able to survive. Like that's what I understood.
Want me to read it from the book?
So before viability, that's when you're allowed to terminate. Here's the thing, you know, with regards to abortion, some nurses may have an ethical dilemma as it relates to abortion, right? Because maybe the dilemma may be as a result of the cause of the pregnancy in the first place, who is pregnant in the second place. Now, when I say who, in terms of the age group, because there are children who are young and then they end up getting pregnant, and then
Yeah, but it's not on us to make that decision.
no, it's not. I'm saying the ethical dilemma that the nurse may face. It is not. You are absolutely correct. It is not on you, but some nurses may face, because the ethical dilemma still exists. Remember we said when we have our own ethical issues, our own biases and stuff like that, or what things should be and etc. We have to address those issues. And then they also have, nurses have the problem with, they may have their own personal beliefs that may go against that. So for example, some nurses may be completely against abortion for whatever reason, because life is life no matter how it came here, okay? For example, how is a nurse going to deal with the situation, let's say for example, who's against abortion, but then has a client who wants to abort their child? How is the nurse supposed to deal with that situation?
The book said to like let your charge person know about it ahead of time so they can switch nurses.
Okay, so we can switch your assignment. Okay, that's one. Danny?
I think you gotta put it aside sometimes in a lot of situations. I mean, you're gonna do a job, you know what I mean? If you don't agree with it, that's fine, but, you know, keep it to yourself. You gotta be the best nurse you can be for your patient.
Cause what if it's 12 patients on the floor and I got 4, you got 3? Well, I'm sorry, that's a bad example. There's 8 patients on the floor, I got 4, no, 5, and she has 3 because she doesn't agree with it.
Well, a good charge nurse is going to balance it out, but that's what, oh God.
Oh wow.
But what if 5 of them trying to think about getting abortions?
She shouldn't be there.
Cassie!
Lady, be so for real.
I forgot Cassie's name.
Oh,
I'm sorry. There's too much going on. But Cassie said, hold up. She addressed that already. She said, let your charge nurse know so that she can address that and make the assignment as is.
We understand that part.
Okay.
But like I said, what if it's 5 of them that are thinking about getting abortions?
She shouldn't be on the floor.
She shouldn't be on the floor, period. She can go home.
She got to make money though.
She can clock out.
Oh, whoop. and then more shortage. So to best, now there's no 100% great way, but what Cassie's saying is true. If you are making that aware, the charge nurse would more than likely make the assignment accordingly, okay, ahead of time for you not to get a patient that comes in with an abortion. Now, let's say during the middle of the shift that happens, one way to remedy that is maybe switch assignments. You could just say, okay, Cassie, you don't want this patient that's about to get aborted, okay, that's going to have an abortion? All right. Switch patients with her. You get to give her the hardest patient you have, and then, hey, we keep it moving.
But the patient might feel some type of way after that.
No, usually they don't. They just try to get better.
Isn't that like a specific, like, That's a specialty though. They're not just gonna do that like in an ER. You know what I mean? Like they're not gonna do the abortion in an ER clinic. Like you gotta, like you chose that to go to do that. I guess that field to go do that practice. So at some point you knew that was gonna be a possibility where you come in today and you got 4 or 5 patients and you're gonna have to swallow one of them because that's your patient.
Yeah, but there's emergency services for complications that happen afterwards. That would lead to the emergency room first, so you would still.
Yeah, but that's rare and few in between. We're talking about like you got like.
It's not
something
rare depending on the setting.
Like parenthood. You see what I'm saying? Like you went to a specific, or you went to an OB office, and you knew that your OB does these type of treatments. So like you went and specifically sought out that position. Like I get what you're saying. You have the onesies and twosies that are gonna go ahead and yes, they might be like emergency services, but that's what we're talking about is you got a patient or a person who's working at a clinic that this is what they do. At some point, you got to kind of like, okay, I chose this.
Yeah, but I'm saying you're gonna have more of an ethical dilemma with people who are working in emergency because more people who are okay with that are gonna be in that field. You're gonna have more of a assignment change more in emergency services where you're seeing everything at once, or they get moved from emergency to a med-surg floor. Then you're dealing different stuff with that. More people are gonna be, aware of that factor if they are an OB office because that is obviously something that they constantly deal with.
But what I'm trying to get at, and I agree with you 100%, what I'm trying to get at is when you got somebody like that, it's easier to do what Treasure says, where you can switch out maybe 1 or 2 people for like 1 or 2 cases. Like, okay, you take mine, I take yours, I don't want to deal with this, and that's fine. But what we're talking about is like how if you got 4 or 5 different patients that are on the same floor, that's going to be more like somewhere if you're going to like an actual clinic where this is what they do, where it's a little bit difficult.
Well, the nurse probably would, first of all, if the nurse is against abortion, the nurse wouldn't work in an abortion clinic. That makes no sense. That would make no sense.
Wouldn't work at a pediatric.
Yes, okay?
That's what I'm saying.
Yes, okay? Now, where I was going is with this, that's a good debate though, okay? But where I was going with this is that, what time is it? Well,
10:30.
Ooh, okay. Is that number one, first of all, you're gonna be faced with, there's more than likely a chance that you can have an ethical dilemma. The main thing is, like Danny was saying, is you gotta first of all, be aware that you even have an issue. If you can, put it to the side and deal with the patient. Now, if it's become too much for you, because I've worked with patients and I had to alter assignments, like where I had nurses who did not want to take a patient because they were on a drip rate, morphine drip or dilaudid drip, and they felt like that was a form of euthanasia, which is what they were against. So, I mean, it's easier to just change the assignment and make it easier for everybody. But if it's not possible, because for some reason, you're gonna have to be like, suck it up, buttercup, okay? All right. Now the other issues we have, moving quickly, you have substance misuse. Now, with substance misuse, what is the most common substance misuse you see with pregnant women?
Alcohol.
Alcohol, okay? Caffeine.
It counts as a drug, it's addictive, it's a substance.
Oh, you are right. Not common, but yes, it is a thing. Now, when a pregnant mom has abused alcohol, or while pregnant, what can the baby most likely come out with? Fetal alcohol syndrome. And make sure you note the characteristics of a child who has fetal alcohol syndrome. I don't know any of them. What are they?
Shriek.
What are they?
Shriek.
What is shriek?
High pitch.
Oh, okay, shriek.
Have,
Okay, have it, boys.
The eyes are closer together.
Eyes are like.
Is it closer together or further apart? Further apart.
You better know it, because I don't. What does the book say? Huh?
I don't think it's in this chapter.
Oh, it's not in this one? Yeah, they have the interesting shaped head.
Yeah.
Okay, let me not say weird.
They usually have like some sort of mental deficit.
They will sometimes, yes, they will have a mental deficit. Okay?
Yeah.
Huh?
Cleft lip and palate.
Yeah. It happens.
Cleft lip, because I thought you said left lip. I was gonna say cleft lip is another possibility. Yes. Okay. All right, and then also you have intrauterine therapy. What's the issue with intrauterine therapy? Real quick.
It's controversial.
Why?
Because people don't believe, well, that's the debate, is that some people believe in the science of
taking the fetus out of the womb, doing surgery or whatever they need to do, and then putting them back in, and then vice just letting whatever happen.
You read? Somebody read that book? Okay. Let's keep it moving. All right. You already know the thing with stem cell research and use of embryonic cells. Umbilical cord blood banking was also, that's been a debate for some time too. Public versus private. And then this is the consent. This is what I want to talk about. Consent. Oh, what about it? Talk to me, Ariana.
Assent is for children.
First of all, wait. What is consent again?
Permission?
Yes.
Yes?
That's consent.
Okay. Just yes? No, don't say just yes. But it's permission to do whatever, to do what is that needs to be done, okay? All right. Now you mentioned assent. What the heck is that?
Assent is for our pediatric patients that even though they don't want to say yes or no, they should still know what's happening. So you're letting the child know and getting the child's permission per se.
Now, what's the issue with assent?
It's the ages
Sometimes.
Like teenagers think that what they say will go.
Mm-hmm.
Actually, even though you do have their assent or you don't, the parents are going.
Unless they're emancipated.
Unless they're emancipated, unless they're also what? Pregnant, and there's a third one.
Mental capacity?
No. In your book, if I remember correctly, wasn't there a military?
Yeah, they're a member of the armed forces, married.
Yes, member of the army. Now I don't know how a child is gonna be a member. Is it a
You
thing?
can join at 17. I
Yeah,
joined.
Oh,
you
at
have to have
17?
your parents sign though.
Yeah,
Oh.
my mom had to sign.
Okay. What is the opposite of assent?
Dissent.
Oh, okay. All right, I thought I was gonna get y'all on that one. All right, so that is the issue. So 18, we said all of that stuff. All right, blah blah blah. Moving forward. Legal and ethical concerns, exceptions to parental consent. Now, I had to make sure I put my culture aside when reading this part right here, this issue of assent. So they said they also said with regards to a child being a mature age. What was it? Mature age. 14 is what they said?
Mm-hmm.
Yeah.
Over age 14.
Keep going. I think you passed it.
I did pass it.
It's number 2.
Go back.
There
you go. Over age
Mature minor at 14 years of age? Excuse me?
They even do their own modeling.
Bruh! Yes, Alex.
It's still kind of here, but more on the assent and descent.
Mm-hmm.
It says in the book that the pediatric patient should become the primary decision maker regarding their own health care. So is that like, if they were to have dissent and say no, but the parent said yes,
So here's the thing, and this is how I understand it in the book, and tell me, let me know if this is how you understood it, so we all on the same page. When I read it, if you are going to take the child's permission to do certain things, you're also going to take the child's permission to refuse certain things as well. So if you're going to take on assent, you have to also accept dissent, well, however it's pronounced, okay? All right, so that's the thing. That's how I understood the reading, the literature, all right?
But is there a boundary to that? Like, if it's a, like, you will die if this doesn't happen type of thing, and they're like, no.
there's for the parents, if they say no. Then there's parents patriae or whatever.
Yeah, like there's
The
like
state
a
gets
court
involved.
order.
Say it again.
The state gets involved if the parents saying
No. So
But
here's where it gets sketchy. So let's say, for example, for religious purposes, I think there was several cases. I could remember one case one time with the blood transfusion. Okay. Oh no, I have an even better one. Cancer treatment. There was a young child. She started getting cancer treatment. She was not even, I don't think she was even 14, but she was, you could tell she was kind of mature for her age, had very good understanding. And she started the treatment, but then she didn't want it anymore. Of course, the parents wanted it, but she no longer wanted that treatment anymore. And there was, I think she eventually started refusing, but you know, the parents were the one that were making the decisions for her. I think she went as far as going to either getting a lawyer so she could make her own decision, like become a, what's the word we just said? Emancipated, so that she could get her own treatment, or like she could refuse treatment or whatever. And it was supposedly a life-saving treatment, so those things happen too. But then there is the issue, the case where the law gets involved, or where the child needs that particular treatment, the parent says no, healthcare providers are involved, and they say that the treatment is necessary. If the parents continue to refuse, and healthcare providers are against the parents' refusal, they may get not law enforcement, but the courts or the justice system involved. That has happened. It's very sensitive, to say the least, but it does happen. So yeah.
Well, the problem is there is no black and white, right? Like everything in healthcare is going to be pretty gray.
Yeah.
Especially like, because when you get legal involved, then you're like not letting them be autonomous, right? If they say no to a procedure, and you're like, well, you know, you could die. And they still say no, and you get legal involved, now you've just taken away their autonomy.
Yes.
Right? Especially if it goes through on your favor and you do get involved, whether it saves their life or not. You know, so it's
and then now the autonomy supersedes the benefit of the treatment. Yep. So you're right, the gray areas does exist, okay? Y'all already know about the advanced directives. Now, y'all remember everybody has the right to refuse. You gotta respect that, okay? 8 advanced directives, we gotta make sure, we talked about this, like the advanced directives include the living wills, DNRs, what happened. But there was an interesting one in your book, I don't know if you saw it in your reading, the baby doe regulation. Y'all read that?
What?
The baby doe regulation, Vanessa?
It was like, so there is a terminally ill infant, and basically it goes over the rules that you should follow to help like with their autonomy and just like making them comfortable, like dealing with their like, what's it, like natural passing.
Yeah. Okay, so it's kind of like a special DNR for the baby, for the infant, so to speak. So I thought that was cool. I mean, or interesting at least, to say the least. Okay. Chapter 2. Chapter 2 basically is about evidence-based practice. Okay. So with regards to evidence-based practice in chapter 2, the majority of things that we do as healthcare providers have to be based on evidence. That's really what chapter 2 is mainly about, okay? Scientific evidence. So it involves making sure that we provide care to the patient on the patient's, respecting the patient's values and also their preferences. That is very important as it relates to patient care, providing patient care. Chapter 2 is written not that much, okay? Evidence-based practice. Make sure you use research. Keep it moving. It's really not that much in chapter 2. This is the headache.
Yes.
Growth and development. So, all I gotta say for these 2 chapters, don't play with me. Y'all already was introduced to it in fundamentals, so it shouldn't be any issues, okay? With regards to chapter 25, growth and development. Now, the main thing overall with both of these 2 chapters is that you need to know the developmental milestones for each child, okay? That's the main thing. Now, make sure you understand what is the definition of growth, which basically is the physical size, and development is basically how you acquire skills, so to speak, all right? And of course, you know maturity, what that's all about. Now, with regards to growth, the child, this will may definitely show up. I say may definitely show up in NCLEX. This is, we gotta have this for sure. The size of the infant, okay? You need to make sure you know the average weight, length, and head circumference of the infant and plot them according to what you would expect to see on the growth chart, all right? For the infant, what is the average weight of the infant?
7.5 pounds.
Huh?
7.5 pounds.
Or how many grams? Because I may choose to use grams.
3,400.
34, well,
3
kilograms. It's either
3.4.
3.4 kilograms or 3,400 grams. I'm okay.
You said for the length was how long?
No, the weight. The weight of the child, of the infant, okay, at birth is 7.5 pounds.
Slide 6.
Oh, you're bad. Oh, whatever.
Next one. There you go.
Okay, and then the size doubles by what? Okay, it's there. Double by 4 to 5 months and triples by 12 months. This information, you gotta know this. Yeah, I see this come up in many NCLEX reviews. Okay, you need to know the length as well and the head circumference. It's all listed for you right here. Okay, make sure you know this. Now let's go into. You do need to know the screening tools. Okay? Now the screening tools that are utilized as it relates to assessing a child, they do use the ages and stage questionnaire, they do use the infant toddler, and all of these are tools that are utilized to help adequately assess if the child is growing and they are where they need to be at. That's basically what this is. Now, the physiologic changes. That you must know, my friend. What to expect when the child is going at birth and maturing and up to their first year. Neurologically, do you remember the neural assessments?
Like the names of the tests?
Yes.
Some, I think most of them.
Okay, give me one.
More.
Huh? For the infant. Babinski is one. What's Babinski? The foot. Yes. You can't do Perla on a newborn. You know what? Just for you, I'm gonna put that on the test question. Can you do a Perla? I'm gonna find an interesting way, just for you, okay?
Wait till we
Alright, Perla on a newborn. Oh, dog, we got a problem. What else? What's another neurologic assessment besides Babinski? Gamoro. What else?
The rooting.
Huh?
Rooting.
Rooting. The grass, okay.
Stepping.
Okay. So make sure you remember those neurologic assessment. Now, with regards to respiratory, the infant, well, we should know. Respiratory-wise, their nasal passages is a bit more narrow. Their larynx is what shape? Do we know?
Funnel.
Funnel shape. Okay, they have a funnel-shaped larynx. All right. And also, they have more compliant trachea and chest wall and shorter and narrow bronchi, and significantly fewer alveolar compared to adults. Now, with that said, is that a problem? It is?
Yeah.
I don't know. Y'all the experts. It is? Okay. Dígame por qué es un problema that the respiratory-wise, this is a problem that the infant is like this. Why?
There are more risks for respiratory distress or infections.
Sticker.
Ding dong ding. Do I get a sticker too?
No, she has to know your name.
She has to know your name.
I know.
My bad, Cassie. I got a special sticker for you. That's
I want a
why.
special sticker.
You know what? Hold on.
It's a blank name tag, so you can.
Why you told her that? Oh, damn. She didn't need to know that yet. Okay? Cardiac-wise, what's the issue cardiac-wise with the infant? Quickly.
Congenital heart defect.
Wait. Tell me, what do you see physiologically with the cardiac? Don't tell me the risk factors yet.
It doubles in size the first year.
Okay, the heart doubles in size the first year. What else? Alex?
They have the ductus arteriosa and all that needs to close, doesn't close, so they can get septal defects.
Okay.